So we get this question a lot. Is there a cure for endometriosis, or what's the chance that it will come back, right? The truth is it's not really simple. Every patient is unique. And for the most part, when you excise endometriosis properly and you do it at an earlier stage, stage 1 or 2, the results are excellent. And patient may, by many, many years, their endo may never come back. And some of those patients, I may see them back 8 years later, 10 years later, when they do decide to have a hysterectomy by choice because they don't want to have painful periods anymore, different than just the endo, right? The endo itself at that point may not have recurred, but their uterine pain is still a problem and they don't want to be on birth control until they're 50 or 55. And so that's an option. And even when I've done those cases and we see the pelvis of someone that had previous endo excision in an early stage, frequently we find no more new endo, which is very exciting. However, the uterus at that point has adenomyosis in it. However, there are patients with endometriosis, advanced disease, stage 3, 4, that even their primary surgery of excision, we can't be certain that we've excised every single microscopic cell of endo. And the rates of recurrence in these patients are higher, right? There's patients that even have endo recurrence after removing uterus and ovaries, and they have endo recurrence. So we cannot control all evidence of recurrence of endo, right? And we cannot always predict which patients it will happen in. I would say for the most part, it's more common. What I've seen in the last, 10 plus years of doing endometriosis is that it's more common in patients that have a very aggressive starting point of endometriosis, so that they have endo of stage 3 or 4, diaphragmatic disease, severe ovarian involvement, deep pelvic sidewall, deeply infiltrating endometriosis, higher rates of recurrence in that group.